it's like picture someone sitting beside you and being like, you should eat that. You should eat that. You should eat that. And they just like won't stop telling you what to do. And you're like, okay, I'll do it then. So it's like, it's so hard to just sit with the uncomfortable feeling. But as I know, because I've been practicing not binge eating, I started to just sit with it. And I was really, really shocked at how fast it went away and how like fast I was able to create this new habit. I honestly thought it would take me months, and it took me about like 3 tries.
Hey Shelby,
Hi, how are you?
I'm good, thanks. How are you doing?
I'm doing well.
Good, good. So, third session in, I wanted to just, you know me, I like to set our agenda. So, I wanted to find out what was on your list. I know you like to take notes in between sessions, and then I can tell you a little bit about what I was thinking and we can jump right in. How does that sound?
Yeah, that's great. I have it listed out here. So I'll just go through it. So if we talk about the last 2 weeks, did something really big a few days ago. So I want to talk about that because I use some of our techniques that I've been learning with you. So I'm really
Great.
excited about that. I'm about halfway through the book, The Body Keeps the Score.
Oh, wow.
And then I also wanted to talk today about kind of like why I hold stress in my stomach and some ways that I can deal with that and help like the less stress in my stomach, basically.
Okay.
And then a little bit I wanted to talk about food and like my relationship with food. And then I had a question about why I default to crying as my main emotion, where other people it might be anger or etc. And then I have one thing I want to talk about. Maybe it's a little bit of like people pleasing, where I have a hard time doing what I want to do some days, and I just kind of default to what other people want to do. So, yeah, those are the things.
Okay. So I just want to make sure that I got everything. So relationship with food and some issues around that, holding stress in your stomach, right, or that anxiety. My guess is there's some relational component there, right? You did a really big thing and used your skills. So 10 gold stars. I can't wait to hear about that. Um, and then also talking a little bit more about, I think, just relational stuff with the anxiety, if I'm hearing you correctly. Did I get
Mhm.
everything?
Yeah.
Okay, good. And I just wanted to follow up from last time. It was a difficult session, and I wanted to see if you had any more thoughts on that, if you felt like there were some things that were left undone from our session that we needed to revisit or that you thought of.
No, I think for me, it'll just be about like practicing the techniques. And
Okay.
I think the more I practice them, like the easier I'm hoping that it'll get. So no, I can't really think of anything that was left undone. Yeah, I want to keep practicing. Mostly I've been focusing on the breathing one. I think for me, the breathing one has been helping the most.
Okay. And then the other thing you said too was, why do you cry? That was the one thing just left off my list. Why do you
Yeah.
cry? And that becomes your default. So where would be a good place for us to start today? Which one do you want to tackle first?
We can do maybe the positives from the last
Oh,
2 weeks.
okay. That sounds great.
Okay, so I was really proud because I'm really scared of heights, and me and my partner have been talking about doing this climb for the past 3 years. It was over 500 meters in elevation of climbing. It was an 8 hour way up and a 2 hour hike down, so it was huge. There was 19 climbs in it. And it's just something like I didn't really think I could do. And I try not to think too much about it beforehand, or else I'll psych myself out. Sorry. I was always like that during a test too. Like I would never, some people would study right before the test. I would just be like, no, it's in here. When I get there, it's just going to flow. So that's what I try to do too. I just was not thinking about it until it was happening. And for fun, I took a poll and I asked all my friends, I said, how many times do you think I'm going to cry on this climb? And everyone was like, so many times, like every single climb. Anyway, I only had one really big cry, which was I was super proud of. But my partner said the whole time my eyes were like this big. He's like, every time I looked at you, you looked like you were in like a state of panic. And I was like, I was very anxious, but I practiced 4 techniques, which I'm super proud of. So I practiced deep breathing was my main one. The whole time I was just like, deep breath in, deep
Good job.
breath out. So just like trying to calm myself. Because there was a lot of the climbs where he couldn't see me too. So I was alone. So I was like, okay, come on, you got this, you know? So that brings me into my next one. I was doing a lot of positive self-talk. I was like being my own, like I was encouraging myself. I was saying, like, you got this, like in my own voice, you got this, Shelby, like, come on, like keep going, and just like really be encouraging towards myself. So I was proud of that. And then the next one I was doing was visualization. So instead of visualizing, that the rope would break or that I would fall and I would die, I was visualizing like how well I was going to do on the climb, or, seeing my partner again, and more positive things. And then again, I was doing the reframing through words as well. So when it started to get windy, I started to get really afraid because we were so high up, and I kept picturing like me blowing off the cliff. Instead, I would be like, oh, wow, the wind feels really good on my skin, or like things like that. So yeah, I got to practice the four. I mean, I had lots of time because it was a full 8 hours of this. So yeah.
That is that is so awesome. How do you feel about yourself and your success?
Oh, I feel really good. Like I said, it was something that I didn't think that I was able to accomplish. And I mean, I was panicked and afraid the entire time, but at least I got through it. And there was at one point I wanted to, you could walk off at one point out of the whole thing. And I honestly considered walking off. I can tell you about why I actually ended up crying.
Okay.
So I was debating whether I want to walk off, and my partner said, we only have 3 more climbs. Like, we've already come this far. Let's just keep going. And if you want, I said, okay, let's keep going. But then as he's going up this climb, these 3 other people come by, and I asked them just to make sure that we're on the right one, because there's so many on this wall. And they say, oh no, I don't think you guys are on the right one. There's 7 left. So now I'm emotionally, mentally, and physically just like exhausted. And I do not want to do 7 more. Like I just don't think I have it in me. And it's too late because I called Tate and he's already up and he's on it. He's like, I think we just need to continue now. And so I do this climb, and it's the hardest one out of the whole series. And it was like not something I was capable of, even with him like helping me up and me pulling on the draws, which you're not like,
Mhm.
technically whatever you're supposed to do. And even then, I was still having a hard time getting up. So when I saw him, I just started like breaking down crying, and he's really good at consoling me and stuff. And he gives me a good pep talk and all that. But yeah, that was the only time that I really had a breakdown. And I mean, it made sense for me, and I was accepting of it. So
Okay, so few things, right? One is that you started off saying, okay, I was making bets with my friends to see how many times you cried. And it sounds like, and they were all like, oh, a lot, right? But you only cried once. Okay,
yeah,
that's a huge win, right?
yeah.
Yeah.
I mean,
Okay,
I had tears in my eyes a few times, but they didn't fall, so I don't think it counts.
that doesn't count. We're not going to count that. And then the other thing that you said is that I couldn't do it. I couldn't get up there. And so when I saw Tate, I started to cry. But you did do it, right?
I mean, yeah, I did do it with his help,
Yeah.
thankfully, but yeah, I did do it.
But you did do it. So you can do it, right? You could do it, but you can do it.
Right.
Yeah. So notice like so sit with that for a second, right? Like you can do it. What does that feel like? Not what do you think about it, but what does that feel like? That you can do it.
Like proud? Is that
Yeah.
okay?
Yeah. Yeah.
Yeah, I was super fulfilled after. I felt really good. I get really chatty when I get fulfilled, so I just like chatted all night about it.
Well, I think it's a big milestone, right? Because, you started off, especially with our session, saying like, I'm terrified of heights. I'm afraid I'm going to die. Like from that to just a few weeks of like, that was the hardest part of an 8-hour climb, that's huge to begin with, right? That you can do that 8-hour climb. And then the hardest part of the climb, you can do that too.
Right. Yeah. And it was interesting to push myself in a way too, where the third last one, I wasn't interested in doing it. I was like, no, I don't want to do this. Like, I'm out. But when you're kind of faced with no choice, it's like, no, you kind of have to. You can't just be stuck on the side of the cliff, you know? So just to kind of push myself to do something, even though I didn't want to do it, it reminds me of like every day too. You know, some days you don't, I don't know, feel like cleaning the house or
Right.
working that day, you're not feeling well, but kind of pushing yourself to do it anyway or get into a consistent routine. That's not to say that people don't need breaks, like, of course,
Sure. So,
but
I mean, so in a way, were you surprised at how resilient you actually
hmm.
are?
Mm-hmm. Yeah, and I kept reminding myself when I think you called it like indexing our last
Hmm.
session, how I was able to calm myself down through those breathing techniques. Well, I kept referencing that. I kept being like, well, I calm myself down that one time, so I know I'm capable of it. So
Good.
every time I'm in a situation where I feel anxious, I go back to that, like you said, and I reference it and be like, oh, I'm capable of calming myself down.
Yeah. Good. And so, okay, so did it, super chatty, came back down. It sounds like you actually had a lot of fun.
Yeah, there was I paused there because there was points of it where it was fun, but I'm not gonna lie, there was points of it where I was done. I was ready to come down and be on the ground, but
Hmm.
it was all worth it in the end.
Got it. So what's the big, like, I want to say not kind of thought takeaway, but like emotionally, like what's your big emotional takeaway about how you're feeling about the experience?
I guess I kind of felt, I told my partner this too after I was like, I feel like I can do anything now. You know, I feel like I'm very capable of more than I thought, like mentally, emotionally, and physically. And yeah, I just feel like I learned so much. So yeah, I was just overall super fulfilled, I think is a good emotional word to use.
Great. And again highlighting that you did that. Like, you were able to do it. You used your skills, not that it wasn't hard, scary, and challenging, right? Not but and you still did it.
Yeah, it's super interesting timing too, because I keep wondering if I would have done this maybe a year or two ago before I started therapy, if I would have been as successful as I was, like had I not, would I have been able to continue? Would I have cried more? Would I have known those techniques, right?
Right.
So I think it was just really good timing.
Perfect. Yeah, sometimes that's the trick with therapy too, is it is all about the timing, for whatever reason, just not the right time, weren't ready, whatever, doesn't even matter, right? I think just staying to this positive of remembering how the pride that you feel and that resilience, the resiliency that you feel, and that becomes your new indexing event. Make sense? So
Yeah.
like when things get hard, you're like, wait a minute, I can do hard things. I've done hard things, right? It's okay that it's hard. It's okay that I may struggle. It's okay if I cry, right? I have the skills now to get myself through the hard moments, and I can do hard things. So, really starting to make that your mantra and keep that as your new indexing event. Does that make sense?
Yeah. Okay.
Cool. So cool.
Actually, I think that's a good time to talk about then why like crying is my default emotion.
It's a great question, and I don't know if there's a real specific individualized response. I think what happens is for some people, and we talked in our first session, right? And I said, you're very empathic. You feel all your feels and you feel everybody else's feels all at the same time. And so I think because that's just your character, your nature of who you are, then that's not a negative. I think it's just, it is what it is. That's the way that expresses for you. So I feel like for you, it's this build up overwhelm. If you think about a tea kettle, I think we might have talked about that analogy before, right? You fill it up with water, you put it on the stove, and it steams. Eventually, it whistles, right? And what happens is it burns out if you were to leave it on the stove, right? And you take it off the stove, it stops whistling. And so it's a really good analogy for, I think this. I think what happens is you bubble up, and so instead of yelling or completely emotionally shutting down, right? Your reaction is that you cry. That's that release valve, right? And then you can sort of start to recenter yourself. And so what I love about we say in narrative therapy, the story, that's not meant to be dismissive or degrading. It's a term we use in narrative therapy. So when you're talking about the story and how you are feeling and experiencing the climb, right? That's a really good example of using your skills and tools to be able to develop a different way to manage some of the fear, anxiety. So it's not getting to that point where you're boiling, it's bubbling over and you're crying. Does that make sense?
Yeah, okay, okay, okay. Like what's that called when you do something like rehab.
Yeah.
Yeah. Like try okay. It was
It,
in my head. I can't explain it, but I understand.
yeah, it's just it's your trained response. Some of it comes from um people will come in and they say, like, I get so frustrated that instead of yelling or being super focused or shutting down, I cry. Like, I'm not sad. It's my response to feeling overwhelmed and frustrated. Other people will say, I feel everything. And so when I'm listening to things or I'm watching social media or my going through my friends' experiences, I cry. So I
Mhm.
think the crying is a very unique thing. It's more complicated than we think. So I think for you, when we talk about that being your defense mechanism, right? I think that's what's happening is that you're just flooded. And so it's the pressure relief valve for you. So what you're learning now is that with that breathing and the positive reframing, using those indexing events, right? You can start to relieve some of that pressure before it gets to the point where you're panicked and crying.
Okay. That's what I was trying to say. It's kind of like stretching your muscles so that, you're warmed up and you don't break something or hurt yourself. I was trying to say like prehab, like
Yeah,
rather than after the fact, like learning these techniques so that I don't get to that point.
exactly.
Okay.
And then what I love, there's so much about your experience that I love. I'm super proud of you. Like I said, 10 gold stars. Like you did therapy perfect. Um, and you managed the situation really well. Not, but you still cried. Because anytime we say but, we negate what we just experienced. I think it's okay. And you cried once, which was significantly less than you thought.
Mhm.
And it was still not but, and it was still okay. So it's like you went through this really hard thing. You you still had a moment where you cried, and you were able to complete the climb without having the panic and anxiety. Be really proud of yourself, prove to yourself that you're resilient. And so even if you have a few moments where you are crying, you were able to reset and get back on track super quickly,
Right.
right?
Okay. Okay. Thank you.
Yeah. So the goal is that, is it realistic to say that my goal is to never ever cry in situations like that? Probably not. Like, I don't know if that's even what you would want.
Right. Yeah, because sometimes it feels good, to let it out and to not hold it in.
Yeah, it's cathartic, right? Like, after a really good cry, it's like there's that emotional exhaustion, but then we feel lighter. I don't want to say better, but there's this sort of like, okay, I don't feel so weighted down. And so keeping that in mind too, where maybe that was part of the process for you to get through something that was really scary. You're really high up, the wind is like, there's a lot of factors that would cause that anxiety. And so maybe the crying and that release is more cathartic and it allowed you to continue. It may not be a negative either.
Right. I found it super interesting how high alert I was to sounds too,
Ah,
because I talked to my partner after and I said when because the highway's right there. And so you hear a lot of the traffic, but there was an ambulance go by. And immediately I almost like went into a panic a little bit. And my partner's like, I didn't even hear the ambulance. So I was just like on hyper alert, or there was like a few people to the right of us like yelling back and forth to each other, and that kind of freaked me out a bit too. And he's like, "Yeah, I didn't really notice that much." So I guess that's that hyper alertness,
Mhm.
right?
Exactly. And so your senses are going to be fine tuned. So you're paying attention. We call it like situational awareness. You're starting to pay attention to all of the different factors in that particular situation. And that's not, again, not a bad thing to have. It's really more about using that to your advantage. So you hear the ambulance, you may look around and log to make sure everything's okay, and then that I'm okay and positive reframing and then getting back to climbing again, right? Because
Okay.
that's actually part of your safety mechanism, your internal safety mechanism. And so you want that to work for you when you need it. It doesn't have to be on hyperdrive all the time, right? But that's not something that we really want to, let's say, like, oh, let's work on getting rid of that per se.
Okay.
Yeah,
It's kind of like mindfulness when your like thoughts are kind of trying to drive you a certain direction and then you kind of revert them back to the
exactly.
present. Okay.
Yeah,
Okay.
good analogy. Yeah.
Yeah. Okay. Cool. So yeah, I next if we're able to talk about kind of why I hold stress in my stomach, because everyone holds it in different places, right?
Hmm.
So maybe why like mine's in my stomach and maybe techniques to help with that. I actually I have IBS, so someone just recommended that I try Pilates. I've
Hmm.
literally never tried Pilates in my life, but I just followed a 25-minute YouTube video yesterday. And it was actually really nice. It did help me feel better. Like I get trapped gas and it was helping with that.
Hmm.
Um, so I don't know if you've heard anything about Pilates helping with this, but
Yeah, Pilates, yoga, there's, YouTube has a plethora of videos, and you you can look for any kind of yoga, mat Pilates, stretching exercises for IBS. There's
okay.
actually some really good stuff out there, and that might help. Um, I think we talked about it before, where that fight, flight, freeze mechanism. And all of our emotional regulation hormones, so things like dopamine and serotonin, actually primarily are produced in the stomach, not in our brain. And so when you get nervous, if you're having an IBS attack, if it's something is scary, right? Or that stress where you know that you notice your body is kind of clenching,
Mhm.
it makes sense, right? That your stomach is going to start to really feel upset. And so I would take a look at, there's a lot of really good free apps, and again on YouTube, some maybe 2-minute guided meditations for stomach upset, IBS, or holding anxiety in the stomach, and that might help for you to have something go to on your phone that in those moments you can listen to see if you can kind of calm some of that down. I think it makes sense to me. I think some of it is just that's the way that your biochemistry is wired. And so reducing stress for you, especially since you're carrying it in the stomach, and then you also have the IBS, it's going to make it worse, would be helpful. But that's what's happening, is most of the stress hormones and emotional regulating hormones are in your stomach. So
Interesting.
that's
Okay.
what that's why that if I don't know if you get nauseous
Uh-huh.
when you get stressed out.
Yeah.
Yeah, that's all of that stuff. And so um, I'm not a prescribing physician. I have read research where there's certain supplements that help with that. I wouldn't suggest to recommend any today. It's not my scope of practice.
Mhm.
It might be worth talking if you have a doctor or functional medicine specialist. Acupressure helps. That you can do that on yourself.
Okay.
That's you talked about self massage, so it's a little bit similar. It's just there are different acupressure points in your body that help alleviate some of that the stomach upset, and then acupuncture, which you would go to a clinician to do. Yeah.
Can't do that one.
No.
It gives
No.
me anxiety when I'm
Okay.
there. I just
Never mind. Forget that.
But I like the other ones, so thank you.
Yeah, acupressure. There's a lot of different points in your hands that and your feet that relate to stomach and GI issues. Again, there's some really good explainer YouTube videos out there. They're easy to do. Like you can do it at this one here is usually for headaches. Like you can do this at your desk and do some acupressure that might alleviate some of the symptoms for you too.
Okay.
But again, I'm not an MD, so I'm not, a medical doctor, so I would want you to like if you notice it's getting worse, check in with your medical doctor just to make sure that there's nothing organically going on. I don't want to say, "Oh, it's anxiety," and we miss that, well, maybe there's something more to it.
Right, thank you. Yeah, I've had a few things done and have looked at, and they
Okay.
said they can't really see anything, so kind of
Okay.
declared it as IBS, but it's always a hard one because yeah. So what was I gonna say here? Oh yeah. So I was talking to a dietitian for about 4 months, and that was super helpful to kind of rebuild my relationship with food. But one of the things, and I also read the book Brain Over Binge by Katherine Hanson. Have you read it?
It's a good one.
I loved it. Like life changing. It was incredible.
Hmm.
So, one of the things I'm still struggling with though is say I ate good for the day and then I start feeling not so good in my stomach. I kind of like punish myself. I go, oh, okay, well, then you're not feeling good, even though you took all the necessary steps to feel good. Well, now I'm just going to continue the rest of the day and not eat food that's going to make me feel good.
Hmm.
So I don't know why I'm punishing myself because it's only me who has to deal with the pain, right? But I don't really know how to get kind of through that.
So where do you think that ties into? So we had talked about, core beliefs, right? That if I don't climb well, then, Tate's not going to love me, right? Or Tate's going to abandon me. We remember we talked about that in our first session. I'm wondering if there's something there around food, like, oh, I still didn't do it perfect,
Mhm.
right? So I'm wondering, like, okay, if you know what I mean, even if you ate foods that make you feel good,
Mhm.
and you still have some upset with it, I wonder what that means to you.
Right. I don't know. I might need more help with this one.
Yeah. Yeah, so do you feel like it's a perfection thing? Like I still didn't do it, you know, good enough or
I'm more just like annoyed that I'm in pain so often.
okay.
And I just feel like I take a lot of steps to, avoiding certain foods. And I've been eating more mindfully and more intuitively and eating slower and trying to eat without distractions. I just feel like I have to take all these like extra steps. Sometimes when I see like my partner just being able to eat like whatever he wants and he feels fine. And it's just frustrating to me because, even though I take these steps, I still don't feel good some days. So then it's like, well, if you're going to do this to me, body, I'm going to do this to you. Actually, and I do hold people to a certain level. Now we're getting to it. I hold people to a certain level, maybe, and I expect them to treat me the way I treat them. But I think sometimes too high, even myself. So maybe I'm kind of holding my body to an unrealistic expectation.
Do you feel like it's like body betrayal? Like, my body should be, right? Should be acting a certain way or, my digestive system should be functional and I
Yes,
feel dysfunction.
yes, definitely. Yeah, I feel like it's betraying me. I'm like, I'm being good to you right now. Why are you doing this to me?
Okay. And so then the self-sabotage is what do you think that's about when you're like, I call it the efforts, where right? The fill in the blank, right?
Oh, the epic. I
Yeah,
like
right.
that.
Where you're kind of like, all right, F it. Like I've done all this work and I'm still getting the same result as if I didn't do the work in the first place.
Right.
Does that resonate?
Yes. Yeah. Where does that come from?
Yeah.
It's just frustrating, I guess. I don't, can
So
I,
like when you like you said, okay, you've done done well with your eating for that day and you're like, I ate foods that are good for my body. Because I don't believe that there are good foods and bad foods. It's a whole nother discussion. So
Yeah.
you ate foods that were good for your body and you still have distress. So tell me the emotions. So frustration,
Yeah. Uh,
betrayal, what else?
pain,
Okay.
like uncomfortable. Um,
What do you
yeah.
emotionally feel?
Um, wait, is that different from the emotions we just named?
Yeah, like so you gave me your physical symptoms, but emotions like, okay, so frustration, betrayal, do you feel like a sense of like giving up, like why bother?
Yeah. Yeah. What would you call that?
Um, I call it like this emotional fatigue,
Okay.
right? But just sort of apathy, right? That would be the name for the emotion, feeling apathetic, like, why bother?
Yeah, that one.
Okay.
Yeah. Sad, I guess.
Okay.
Yeah. Confused. Actually, I'm confused because I'm like, I did this and this is supposed to equal that, and it's not.
Okay. Anger?
Well, more frustrated. I,
More
I don't, I
frustrated.
don't, I
Okay.
don't get super, I don't feel that one a lot, anger.
Okay. Got it. Anything else like emotionally?
I don't think so. I think that's
Okay.
all of them. Yeah.
So what do you get out of like the okay, the F it, I'll just do it anyway. Like so it doesn't mean that's positive, like you're getting something great from it. So could be a negative. So what do you get when you say,
Well, I'm getting more pain, that's for sure.
for sure. Okay, what else? Keep going. Give me a laundry list.
Okay, so more pain. Like I'm probably upset with myself because I'm like, well, you shouldn't have done that. Regret.
Okay.
Um, I'm still sad because now I'm still in pain.
Mm-hmm.
Yeah.
Do you feel undeserving? Would that be a fair characteristic?
I don't, I don't, I don't think so. I don't think
Okay.
that's one of them.
Okay. Um, so self-sabotage. Is it more on the perfectionism side of things where you think things like, um, well, I didn't get it right. Like I'll never get it right. Like I'm not.
Yeah, yes, but I think it's just because I've tried so many things. And
Okay.
it's like, yeah, I do feel like I have to do four things. Like I said, eat slowly, don't eat at late at night. Like there's so many rules I have to follow. So I feel like it's overwhelming. There's so many rules.
So overwhelming, frustrated, and then do you feel like it's too like it's just too it's so hard to maintain that you just never get it right? Would that be a good
Yeah,
say it?
yeah.
Okay. Okay. So so I think so the self-sabotage is I'm never gonna get it right, so then why bother? Does that feel like that resonates?
Yeah, but I mean, I will pick it back up and I will follow the rules, but then every once in a while it's like, oh, it's what's frustrating to me too is that okay, so say I ate something and in my mind there's not a singular thing that it could have been. It's not like, oh, I ate cheese, so that's why I don't feel good because sometimes cheese affects me and sometimes it doesn't. So I'm like, does it matter what kind of cheese? Does it matter how much I eat of it? Like the portion size? So now I go in my head, oh, well, it could have been the gluten in it. Oh, it could have been the cheese. Oh, it could have been that I ate too fast. So it's like, it's confusing and frustrating for me to not know the singular thing it was, because now
Mhm.
it's going to be hard to just avoid that singular thing. And it could have been any of the three or four things that day.
Right. Right. And then going back to the body betrayal, feeling like, I should be able to just eat whatever I want.
Right. Yeah. Ideally. Yeah. That would be nice.
Wouldn't it? Yeah. Um, okay, so where there's a couple of different approaches here. So one question I have for you is, after working with the nutritionist, do you have a list of foods that are kind of the not bad foods, but not good for your body foods? Do you have a list of foods that you can consume in moderation? Do you sort of know these different categories of what works for you?
Yeah, well, for a while, like it's been like a couple of years now, I like garlic and onions are two that I can't, I call them gunions, but
Yeah.
I can't eat those, which is so sad because I used to eat them for breakfast. Like I love them so much. And another thing that's frustrating for me with those is they're healthy.
Mm-hmm.
Again, I'm like, I'm frustrated because I'm like, these are supposed to be nourishing for my body, but I can't eat them, right? Because they cause me too much gas. And then, yeah, so I know sometimes cheese, like I said, I'm still unsure about gluten. Greasy foods is like a big trigger for me. Like even chips,
Mm-hmm.
I find like really hurt my stomach. And then, yeah, the other triggers is eating 3 hours or less before bed, which is hard because my schedule is very all over the place.
Right.
And then eating too much at once. I eat like 6 times a day, really like small portions. I can't eat a lot at once. I get really full quickly. Um, and yeah, like really almost like doing a meditation when I breathe has been really helpful. Just
Mm-hmm.
putting my fork down, taking a few deep breaths, taking a bite, chewing slowly, paying attention to the texture and the taste. But again, it's hard, right? Sometimes I'm in a rush and I'm just like so hungry and I just want to eat a bunch. So a lot of rules.
A lot of rules, and the intuitive eating is really important, especially with IBS. It definitely helps the absorption. So that I think that's great that you're implementing the meditation, mindfulness, breath work, intuitive eating component. I would say it might be worth for you. It might be worth looking at trying to identify the food groups a little bit closer. But that doesn't necessarily get out of the psychology behind like what you're saying, which is, okay, I know this isn't great for me. I did, I did well with my eating. I still feel crummy. So now I'm just like, okay, forget it. I already feel bad, so it doesn't matter what I eat, right? And so there's some magic in there. There's something about that process for you where you're moving into that state of apathy, right? Where, like I said, I call it the efforts. And so if we weren't recording, I would, it, um, yeah, no, I call it the efforts. And so there's something in there for you that's that self-sabotage, right? And so that's what I'm really curious about is what's going on for you when um, it's been a rough day, whether food choices or positive food choices and negative outcome. Make sense?
Yeah, yeah. Well, I know Catherine, she in her book, the Brain Over Binge book, she talks about kind of like how it's just neurological junk that comes up when you want to binge eat. So and the reason I'm not talking about binge eating is because I honestly feel like I have a really good handle on it now. Where before I read this book and before I talked to her, she's a dietitian, sorry, not a nutritionist, but before I spoke to her, I was binge eating like every day. And so the reason I'm not talking about it anymore is because yeah, I feel like I'm a lot better with that now. But where was I going with this?
Oh, we were
Oh
talking
yeah.
about, yeah, go ahead.
Sorry, thank you. So she says that to just when binge eating comes up, just listen to the thoughts, but you don't have to act on them because once you act on them, you're creating a habit. So I'm just wondering in this way, when I say, oh, I just want to say F it, I'm just going to eat this even though I'm not going to feel good. I wonder if I just have to listen to those thoughts and disregard them and not act on them so that I'm not continuing to, like continue this habit.
Right. So, with people who have medical conditions where, the food that they're eating is going to cause them some, a medically explained response, right? Um, it's a decision point of, do I want to do this or not? And can I do this in moderation, right? And so, um, um, for me, right, I'm a retired ballerina. So for me, these we're these are big deal concepts that I work on. So sometimes it's like, okay, I can have a few and be okay. And then there are other times where I'm like, no, I don't think I have the emotional wherewithal, right? Like I'm just, for whatever reason, I'm fatigued, I'm stressed, I'm tired, whatever the components are. I don't have the ability to self-regulate and moderate that a few for me is going to satisfy the need, because it's not really about what I'm eating. It's about, like you said, kind of that negative cognitive dump, right? The neurological dump. And so looking at it from that perspective of, is this a food where you're like, I know if I have pesto with garlic sauce, like it's going to send me over the edge and I want it anyway, and I'm willing to just deal with the pain. So you're making a very conscious choice, or
Oh,
like, right? Like, or I know if I eat this, this is really going to make me sick, and I'm going to choose like something else, right? Instead, that I like equally as much. Do you see what I mean?
yeah,
Like some of it is the choice point. That's still not the necessarily what's driving the psychology behind it.
right. Well, that's a weird one too, because I've done that so many times where I know something is going to make me feel like be in pain, and I still choose to do it. And it's like now satisfaction, short-term satisfaction for long-term dissatisfaction.
Right. And so, so what's that about, right? Do you know that, like, do you do that when you're only alone? Do you do it when you're out in a big group? Or if you go to, like, for me, it's really hard to go out to someone's house for dinner and they make things and I'm like,
Mhm.
I, I have celiac. So I'm like, I know that I can't have it. And then I eat it anyway because I don't want to be rude,
Yes.
right?
Yeah,
Okay.
all the time.
All
Yeah.
the time, right? I'm working on that with my therapist, right? Like, so that's all about the people pleasing you talked about earlier. So
Mhm.
there's that negative, like the secondary or the positive, like what do I get from that negative behavior is, well, I don't have to be embarrassed. I don't have to call myself out and everybody has to like, oh, Joe needs to have a different like I avoid all of that, right? By just doing something I know is going to make me feel bad. Because physically feeling bad for me is not as difficult as emotionally feeling bad. So that's
Oh,
what I'm trying to get at for you. Like, okay, so why do you think you engage in the behavior when you're like, I know this is going to make me feel bad?
right. That's interesting. And another thing I just thought of is I find a lot of people comment on like how much I eat. For example, like, oh, you're only going to eat that one thing, like you were just starving and stuff like that. So I find that hard because when I was younger, not with like my immediate family, like my mom, my dad, or my brother, anything like that, but with my grandparents, uncles, and aunts, I
Mhm.
just found that I could like never be good enough for them in the sense of my weight. So when I was growing up, I had gained a bit of weight. And then they would comment and be like, oh, you're getting fat or you're getting big and stuff like that. So then I lost a bunch of weight. And then they would say, oh, you're too skinny. Like, why'd you lose all that weight? So it was just like, I can never impress you guys, like no matter what I do, you guys are just always going to comment on my weight, even though I was happy with my weight, when I found a good weight for me, it was still like didn't feel good enough. So now when I'm around people, I sometimes feel the need to like overeat to prove to people that I'm eating enough or that like, you know what I mean?
Yes. Yeah. So do you find that your family or friends still do that? They comment about, you said they comment about how much you're eating, but do they comment about your body type and what your body looks like?
Yeah, for sure. Like I find they'll say, "Oh, you're so small," or like, "I don't see how you could lose like any more weight," or things like that for sure. And I mean, me, like not everyone would be like this, but now I take it as a compliment when people say like, "Oh, you're so small," because like I'm happy with my weight now, but I know that's like still probably not the most positive thing to say to someone because some people don't like when you say that to them, you know?
Yeah, so it could be that these are still subconscious triggers for you. And so some of it is, do you feel comfortable saying, thank you? Um, that actually isn't helpful for me to hear. Like, so some of it is, I'm looking at your facial expression.
I can't say that.
Yeah. Okay. So, yeah, so part of it is, like you said, kind of getting to a place where you're okay hearing it. When, we've talked about a little bit about trauma. So when we have trauma, we as just a general rule of thumb, we do two things. Either we put on weight because we want to make ourselves bigger. Um, it makes us feel more protected and untouchable, right? Emotionally, physically, spiritually, right? Or we go in the opposite direction and we try and get as small as we possibly can, right? Again, it just, so then we don't take up space, and there's a safety mechanism in that. And so, like all of the stuff you're talking about with the way that you process food, the stress you hold in your stomach, and the eating, and then the what we would call, the your family's comments, right? And all of that stuff is really related. And so it makes sense to me, right, when you're like, I kind of yo-yo a little bit, or I did when I was a kid, right? And then the comments coming in, especially with multi-generational families, food is love. There was a book that was written like long before me, like in the 1970s, and that was what the title was. It was one of the first books on eating disorders and moving like into this idea of intuitive eating. Roth is the author. It's really interesting, but when you think about, you probably have a lot of really happy family memories around food too, and dinners and being rewarded, like, hey, I'll take you out for ice cream or whatever it is. So it's really a complex problem. So for you, kind of trying to break those pieces up a little bit, where food is food is food is food, right? You know that some foods make you feel good, other foods make your body feel bad, right? Not bad food. And when you self sabotage, right, what are you actually getting from it? You know? Because does that make sense? You're kind of re-triggering those old tapes of, oh, Shelby, it's that shoulda, woulda, coulda stuff we talked about before. Does that
Right.
does that resonate?
Yeah, well, one thing that I had read too, I go on Reddit for everything. I literally will
Okay.
type in a question and type in Reddit at the end because I love to hear what other people are going through, just like normal day-to-day people. So someone said that food's a really difficult one because whereas if you think of, I mean, all addictions are hard, but I'm just saying, where
Mhm.
if you think of like alcohol and smoking, all that, you technically don't need that to survive, but you need
Mhm.
food to survive. This is their words.
Yep.
And so you have to live to manage it. You cannot get rid of it. So
Right.
it makes it pretty tough to be able to cope with it, you know?
Exactly. And so, yeah, and that's my background. My dissertation was broad spectrum eating disorders, trauma, and PTSD. Remember, I'm a ballerina, so you can draw the dots. Yeah. But yes, that's absolutely the case, right? And so, um, it's not something where you say, okay, well, I just won't eat.
Right.
I always say there's no luxury to it. So it really puts you in a position of having to do the emotional work of, what am I getting from this, right? When it makes me feel frustrated, it makes me feel left out, it makes me feel betrayed, like my body's betraying me, it makes me sad. When you're in that space, like, what am I getting from eating the food anyway? Do you see what I'm saying? Like, what am I getting from keeping myself stuck, as opposed to saying, I'm going to make a choice, I'm going to have something in moderation, and I'm willing to sit with the fact that that's not going to make me feel good. right?
Yeah, I think what I'm getting out of it, and she talks about this in the book, and I found this super interesting, is I get rid of the uncomfortable feeling of sitting with it. It's like picture someone sitting beside you and being like, you should eat that, you should eat that, you should eat that. And they just like won't stop telling you what to do. And you're like, okay, I'll do it then. So
Yeah.
it's like, it's so hard to just sit with the uncomfortable feeling. But as I know, because I've been practicing not binge eating, I started to just sit with it. And I was really, really shocked at how fast it went away and how like fast I was able to create this new habit. I honestly thought it would take me months, and it took me about like 3 tries. And I already noticed how like much easier it is now. And I
Mm.
haven't really like binged eat much since I started reading the book. So I think if I try the same method and sitting, like you said, with the reflection of like, what am I gaining out of this? Then I feel like it'll help me be like, oh, well, I'm not really gaining anything positive. Yes, I have to sit with the uncomfortable feeling, but it's probably worth the uncomfortable feeling I'm going to feel physically for the next 2 days.
So two thoughts, right? I mean that sounds like that's a really good place to start to rewrite the script in your head. Remember, narrative therapy, we talk about stories and scripts, right? So rewriting that negative self-talk or that script in your head. And with DBT, dialectical behavior therapy, they said that typically the thought is the feelings feel like they last for 10 minutes, and in reality it's 30 seconds.
Oh, really?
Yeah, but it feels like it's so long. So that always resonated for me because then I'm like, I could do anything for 30 seconds, right? Like okay. For other people, they do a replacement. So they'll say, okay, well, if I know X is going to make me feel sick and Y doesn't, I'll just have Y instead.
Okay.
Right, right. So I get that satisfaction. So really identifying the feeling. And so doing that through therapy of like, okay, what really is that feeling when I say I'm really uncomfortable, I really want this thing. I know it's not going to make me feel good. F it. Like, I don't care. I'm going to do it anyway. I don't want to sit with the discomfort, is what you said, right? That's way too overwhelming,
Mhm.
right? So, is it like I feel less than, I feel left out? So, see if you can fill in that blank for yourself when you're in that moment of what am I feeling right now? Does that
So,
make
what am
sense?
I feeling physically and emotionally?
Emotionally,
Okay.
what am I feeling, right? So like because if you're already you know how you're feeling physically, you don't feel great,
Okay.
right? So when you're like I'm gonna eat the thing anyway, what am I emotionally feeling right now? Am I hungry, tired, angry, sad, lonely, betrayed, anxious? Do you see what I mean? Like kind of like what am I feeling right now? Oh, I'm feeling sad. Okay, if you have the thing, is it going to make you feel happy?
Right.
I mean, like, what do you think?
Well, yeah, for that time that I'm eating it. Yeah.
Right. For the 5 seconds, right?
Yes. Yeah.
Yeah. Yeah. So, okay, it's going to make me feel happy, right? Yes. In that moment, I will feel happy. And then I'm going to feel what?
Like shit.
Yeah. Right? You're ashamed.
Ashamed. Yes.
Does that resonate?
Yeah.
Yeah.
Yeah. So is it that I have to go do something else to kind of feel like something else that makes me happy, for example?
Yeah, so some people use distraction, meditation, distraction. They get up and go for a walk, change of scenery, shower, wash your face, um, hot tea or cold, cold water. Or so. Yes, distraction is what most people use. Journaling in that moment, if you're in a place where you can journal, is helpful. Um, my favorite technique is if you're in a public place and that's happening where there's a lot of pressure. Um, the ladies' room is a really good excuse. You're like, hey, Shelby, I'll be right back. I just need to run to the ladies.
Okay.
Go in, take a few of your breaths, use your positive reset, right? And then you can re-engage. Chances are your friends are off to a different conversation. Like
Right.
nobody knows what's going on for you unless you tell them.
Right.
So when you notice those feelings coming up, yes, that redirection can be really helpful. So your trick is that two pieces. Identify what the emotion is. What's the emotion? And then if you do the thing, right? We know it's going to make you feel happy for a few seconds. So if you do the thing, is it worth the outcome?
Okay.
Because you know that you're going to feel shame,
Okay.
guilt and shame. So that's that connection point. Does that make sense?
Yeah. And so why does naming the emotion help so much?
Right. When you're talking about things like fear, anxiety, the fear of heights or the fear of dying, that kind of a phobic type of response,
Mhm.
food, anything that's really subconscious, it's stuff that you've trained your brain and your body to do for a really long time for a reason, right? So it's almost like it happens where you're really unaware of the process. And so when we name the emotion, you're making it from a subconscious process where it controls you to a conscious process where you can begin to take control over it. Does that make sense?
Okay, because you're like acknowledging it.
Yeah. Yeah. And so then the more it happens, you're like, oh, I know what that thing is. Okay, I know how that thing actually makes me feel. It doesn't actually make me feel happy. It makes me feel like garbage. And then I feel ashamed and guilty and I'm in pain. And you know what? It is really not worth it in this moment. And you're boom, boom, boom. You've reset and you're off to the next thing. So the goal is not that it never happens. The goal is that when it does happen, you're able to get in there, correct it, redirect, and move on very quickly.
Is
Make
that
sense?
neuroplasticity?
You got it. Good.
Cool.
Yes. Does that make sense? Because when we set ourselves up for failure, and that's that negative perfectionistic response when we're like, oh, I don't ever want this to happen. Well, that's not possible. You're human.
Right.
Right?
Okay.
So
Okay.
the goal for you is when it does happen, I actually have tools to address it.
Okay.
So we're going to start that process by really getting you to identify what the emotion is.
Okay. Okay.
Does that make sense?
Yeah. It's crazy how everything is so interrelated, and like how a lot of these techniques can be used throughout different areas of your life.
Yeah, and the thing about like these skills and techniques is when you find ones that you like, just do them all the time. And then when they stop working, you're like, okay, there's so many other skills, right? So you start to cherry pick the ones that work for you, you know, and they're easier for you to implement, and then you start to throw over the side the things that are like, okay, it works, but it's not a go-to, right? Or it's too hard to access.
Okay. How many would you say there are? Like how many, what number of different techniques are there?
There are so many. I say to clients all the time, I'm going to give you something to try and I need you to tell me if it works. If it does, it tells me what theory to use. And if it doesn't, I'm like, okay, cool, let's scrap that. We'll try different theory. But like just in the 3 sessions we've had, we've done about 7 different therapeutic techniques
Right.
and theoretical orientation models. And part of it is I'm just picking and choosing what I think may work. And as
Okay.
I get to know you more and you have a better idea of what techniques are really working for you, like today, where you're like, okay, I did these 4 things and they worked great,
Right.
we start to tailor make, what your personal skill set is going to be.
Okay.
Yeah, which
Are
is
there hundreds? Sorry.
hundreds and hundreds and
Oh, there
hundreds.
are hundreds.
Yeah,
Okay.
hundreds and hundreds. Yeah, so it's some people say like, oh, I really want to learn cognitive behavioral therapy, and they work with somebody who's got that training only, right? And so there's hundreds of techniques with just in that one model.
Oh, okay.
Yeah, so it's does that yeah, and then there's a lot of overlap too, right? Meditation and breathing is meditation and breathing. It's just the way that the clinician explains it is determines kind of what model they're using.
Okay.
Um, yeah. So, but there's all there's 100 different, at least 100 different breathing techniques. So that's what I'm saying. Okay, you try one. If it doesn't work, we try another one.
Okay. Okay. So there's categories within categories.
Yeah, yeah.
Got it.
It's not like you're going to get to a place where you're like, I've done all the skills. It's like kind of like I joke and go, okay, I've watched all the Netflix. Like I don't want to watch it. It's the same thing. There's so much out there. So you mentioned Brene Brown once before.
Mhm.
Um, like she's got skills and techniques where you might really like some of those, right? I know you've done some CBT skills. That's that positive reframing you did in the 8 months of therapy, right? Um, like there's skills in there that worked really well for you. So like each different model is going to have things where you're like, oh, I really like that, and so you're looking for things that are going to work for you.
Okay.
Yeah,
Cool. Thank
yeah,
you.
yeah. I know we're at an hour. I want to make sure that this is an okay place to stop. We didn't get to everything on your list, but I want
Oh,
to
sweet
make sure.
though.
Okay. I
Yep.
want to make sure if this feels good to you or if there's some things left unfinished that we should really chat about.
No, I just have one funny thing to say. Well, I thought it
Okay.
was funny.
Love it.
Well, when we were on the wall, I just had my one back. I just remembered this. I had my one backpack with like 2 liters of water in it.
Yeah.
And every time I would get nervous, I remember last session when you were like, okay, if you're feeling anxious, let's do the breathing technique and drink some water, bring yourself back to the present. So every time I was anxious, I was drinking my water from my like camelback bag. And so we get to like almost at the top, and my partner's like, hey, can I have some water? And I was like, I drank it all. I felt so bad. He barely got any. And I told him, my therapist said to keep drinking the water every time I was nervous. And I was nervous the whole damn time. Like, and he was just like, well, tell her I got no water. So, yeah.
I'm sorry, Tate.
No, he was doing that. He was fine,
I
but it was
know,
just
I'm
funny.
teasing. It's very funny. He's like, well,
Yeah.
yeah, thanks.
Thanks, girl.
I know. Good, yeah, good for nothing. All right.
But
Well,
yeah,
cool. And I'm excited to hear when we talk next week too about, how this worked. And I think with the food, if it's not triggering, keep a log,
okay.
right? When you're noticing it and writing down the emotions, even if you just keep a like just one word, like angry, frustrated, tired, like
Okay.
just even keeping a list, I think you'll be surprised at how much more there is there for you. And then it sounds like you have an easier time rewriting that once you know what it is. So I'm curious to see once you name it, right? Is it easier for you to sit with it and sort of use those distraction techniques and redirect?
Yeah, I'm interested in trying that.
Yeah,
Cool.
cool. And if you've got any questions, you know how to reach me.
Thank you.
All right. Thanks, Shelby. I'll talk with you next week.
Okay, see you then.